you very much, Shireen. Oh, it's a lovely introduction, thank you. I'm honoured that you've chosen to spend this afternoon on this lovely sunny day listening to me talking about heart disease, the UK's biggest killer, and diabetes, one of the UK's leading causes of chronic disease. So they're both huge topics, and today my aim really is to do them both justice by explaining, first of all, what links them both, so what things they have in common with each other, and then helping you guys to understand some of the studies on in humans that show that diseases can be prevented or reversed using lifestyle techniques. And then I'll spend the last third of the talk discussing with you guys how to practically introduce some of these ideas into your own lives. Because I think that's often the most important thing is actually to take that first step and to make those changes. And I also just wanted to say a big thank you to Plant-Based Health Professionals UK for putting together all these fantastic talks and all these speakers. It's been a fantastic weekend. But before I do start all of that, I did want to briefly talk a bit more about myself. My name is Dr. Gemma Newman. I am a senior partner at a busy NHS GP surgery. I've got nearly 3,000 patients, and I do see an awful lot of people with heart disease and with diabetes. And in fact, I wouldn't mind, as there's a few of us here, just to get a little bit of a show of hands, who here has been affected by heart disease or diabetes? So anyone suffering from heart disease or have a loved one who suffers from heart disease, had a heart attack, a stroke, suffering from diabetes? Yeah, so quite a big proportion of us. And because it is the UK's leading killer, the odds are that it probably will affect most of us in this room personally as well, in due course. And for me, yes, I've got a lot of patience with these diseases, but also it's important to me personally with my own family history. I don't know if you can see it in this light, but there is an old grainy black and white photograph there on the right, which is my great-grandmother and my grandmother, the little girl with the chubby cheeks, and her older sister. Now, my great-aunt, she suffered with diabetes, so I got to see firsthand the effects of diabetes on her life. My grandmother, the little cute girl there on the right, she married that handsome man on the left, and he unfortunately suffered from a heart attack whilst playing tennis, and he died relatively young. They had 2 children, one of whom was my dad in the middle at the bottom. He died prematurely of heart disease after a very minor car accident, and that was obviously very distressing for the whole family. And also my extended family, Dr. Peter Candela, he was my old work partner, and he was like a dad to me. He died of a cardiovascular disease shortly before coming into work, starting his clinic, helping his patients the best way he knew how. And it is a sad reality that many of us, doctors included, don't know the optimal way of living that will prevent or reverse these diseases. That's why it's so important to me to discuss that with you guys today, so you've got some really good ideas to take home with you. Because the British Heart Foundation tells us that every 3 minutes, somebody's admitted to hospital in the UK with a heart attack. Every 3 minutes. This is unbelievable. And when you think about heart disease, you begin to notice that there are certain things that heart disease does have in common with other disorders. So, for example, if you have heart disease, you're over twice as likely to suffer from a debilitating stroke. You're more than twice as likely to suffer from vascular dementia. And if you have diabetes, you're highly likely, unfortunately, to die of cardiovascular disease. 80% of people with diabetes die of a heart attack or a stroke. So you're beginning to see now how these diseases are connected to one another. And as I said, my aim is really to discuss how they are connected, but I wanted to actually inspire you first so that you can understand what kind of changes you might be able to expect in your own lives through the power of specifically plant-based nutrition by explaining just 3 case studies of my own, patients that I've seen in my clinic. So the first is a gentleman with heart disease, the second is a lady with diabetes, and the third is someone with multiple conditions. So first of all, just quickly, I'll talk about patient 1. He is a really nice guy in his late 50s, and he loved his job. He worked as a driver at Heathrow Airport, and he came in to see me really distressed because they'd basically taken his license away from him. He had a spot test medical at work, and they said, your blood pressure is dangerously high, you're not allowed to drive, go to the doctors, get it sorted out, you're not going to be allowed to drive until it is. And they contacted the DVLA, his license was revoked. He came to me understandably upset. He told me he did not want to take any medication. He was insistent upon it because I was quite keen at that point to start him on blood pressure medication, especially because his blood pressure was so dangerously high. He refused. He said, I'm not taking medication. I don't want to be on tablets for the rest of my life. I just want to get back to work. Help me. There must be something else I can do. So I discussed with him the benefits of plant-based nutrition. And I gave him a few tips, a few pointers, and I said, you must come back to me in a few days, and then in another week, and then another couple of weeks, just to monitor you, see how things are going. And his transformation was unbelievable. Now, this man, he wasn't obese, he didn't smoke, so there weren't any obvious risk factors, apart from the fact that he was South African, and he loved his meat, of course. And so the idea of not having it, at first, he thought, what? That's crazy. But he didn't want to take tablets, and he loved his job, so he thought he'd give it a go, and it was amazing. His blood pressure went from 180 over 100 down to 120 over 80 millimeters of mercury without medication within just 2 weeks. I was blown away myself by his results, and I can't guarantee that it's going to be quite so dramatic for everybody else, but it certainly was for him. I took his blood pressure again and again over the course of the next couple of weeks just to be sure that it wasn't a random reading, and then I did his medical, which allowed him to go back to work, so he was really happy with that. The second case study is a lady that you may all be familiar with, a hard-working businesswoman. There she is, falling asleep at the computer. And I think a lot of us can relate to this. We work so hard, and sometimes we feel like we can't live a life having normal, healthy foods. We have to rely on things like caffeine and nicotine and junk food to get us through. And that's how she felt. She came to me, and I gave her a new diagnosis of type 2 diabetes and high lipids in her blood. She was overweight. She was really struggling. So she decided again that drastic interventions were needed if she was going to survive into her retirement. So she was willing to give plant-based nutrition a go. And amazingly, again, I saw some really fantastic results for this lady. Over the course of 12 weeks, in between the blood tests that we did together, her average blood sugars, her HbA1c, went from 67 down to 47, which is a big drop. She also had a high cholesterol. We aim for less than 5. In diabetic patients, we roughly aim for less than 4. In her case, her cholesterol reading was 8, and she managed to bring it down to 3.5 in just 12 weeks. I don't know about you guys, but that was pretty dramatic in my opinion. So she was really pleased. And interestingly, what's fabulous about this is that it appears to be sustainable, because now, a couple of years later, she is still completely medication-free. The last one I want to share to inspire you all is a gentleman, again, in his 50s, and this man had an awful lot of problems. So he had a high blood pressure, he had high cholesterol, high lipids, he had chronic all-over body pain, especially in his shoulder at the time he came to see me, chronic low back pain, chronic depression. He was on antidepressants, cholesterol medications, blood pressure medications, opiate painkillers, 8 different medications in total. And to top it all off, he also had a low-grade prostate cancer. He'd opted for monitoring because he decided he didn't want to risk the side effects of surgery, which might include impotence. So he was being monitored by the urologist every so often with a PSA blood test, prostate-specific antigen. It's a way of monitoring the disease process. When he came to see me, he was feeling pretty desperate. And I hadn't seen him before, though he had been coming in pretty much every couple of weeks for quite some time. We talked about the power of lifestyle change, and specifically in his case, the power of plant-based nutrition. He was skeptical at first, as you might expect, but he was willing to give it a go. He went away, he thought about it, and I didn't see him again for quite some time, months. And then when he came back to see me, I was amazed, because when he walked through the door, he was like a different person. He was so happy. He'd taken it upon himself to stop all 8 of his medications. This gave me some concern, but he'd been monitoring his blood pressure at home, and it was perfect, so he'd stopped his blood pressure tablets. He stopped all of his pain-killing medications. He decided to stop his statin. So I did a blood test to check his lipid profile, and also to check his PSA, his prostate-specific antigen. Predictably enough, he managed to bring his lipids down, so he didn't really need the cholesterol-lowering medications as well. And to top it all, he was able to have a blood test for a PSA which showed that he'd gone from high to almost undetectable levels. So in essence, he had essentially reversed his low-grade prostate cancer as well. This man was hugely inspirational to me because he took on the lessons and he decided to do it for himself. He was the one that did this, nobody else. And he was just overjoyed with the results. And I share this particular case study not because it's about heart disease or diabetes, but because it shows us that many of these diseases are very intimately connected. And as doctors, what we tend to do is we tend to look at one disease and treat it. We take a reductionist approach, which is understandable because that's how we've often found evidence for benefit. You know, certain medications, certain interventions, you have to be very specific in what you're measuring. But really, sometimes it's important to take a step back. So I try and take a step back and then fall over. So rather than just focusing on the blood pressure or the cholesterol level or the prostate cancer, just take a step back, and then as a clinician, what you begin to see is the much bigger picture. Like this picture here. A lot of doctors would look at one body part and say, oh, it's a spear, it's a rope, it's a tree, it's a wall. But it's only when you take a step back, you look at the big picture, you realize the elephant in the room. And the elephant in the room, of course, is that many of these diseases have the same root causes. And unless you try to look at the root causes of disease, it's going to be very difficult to reverse that disease process. And that's what I'm here to talk to you guys about today. I found 3 areas of commonality that I think you might find quite interesting so that you can begin to understand what they've all got in common. The first is oxidative stress. The second is hormonal imbalances. Because our body's hormones, they're a bit like an orchestra. You imagine each hormone is like an individual instrument, and then if you've got the good conductor, the brain, working well, and all the hormones are in the right order and working in the right way, you've got a beautiful symphony. But if some of them go too high, too low, then you end up with a cacophony of noise. So that's what we're going to talk about today, is how hormones can affect both heart disease and diabetes. And then the third area of commonality is gut health and microbiome. So microbiome is all the different bugs that live within our gut and help us to produce certain vitamins, help us to regulate our hormones, and crucially also help potentially against things like heart disease and diabetes. So first of all, we're going to look at oxidative stress. What is oxidative stress? Well, you can see from the slide that oxidative stress can affect all kinds of different body systems. It's not just one thing. And I'd like to explain it in terms of just living, really. The process of living and breathing causes us to release something called free radicals. Everything in life is balanced, so you do need free radicals in order to create energy. What they are is they're reactive oxygen species that are produced in the cell when we breathe and when we do anything really, any of the body's metabolic processes. And they're a bit like pinballs in a pinball machine. So they're small and they're fast moving, and as they move, they can cause damage inside the cell. They can shorten the length of our telomeres, which is the ends of our DNA, effectively aging us on a cellular level. And they also increase our risk of chronic inflammation and, of course, chronic diseases. So what do we do about oxidative stress? So if it's a part of daily life and we can't stop it from happening, how do we reduce the effects of it? And the answer is our bodies produce enzymes, and also the foods that we eat can also help us to neutralize these oxygen species, these free radicals. And in terms of foods, what kinds of foods do we think will actually produce neutralizing effects? I don't know if you guys have thought about this before, but have you heard the term the antioxidant foods? Those are the kinds of foods that essentially neutralize the free radical oxygen species by donating electrons to them, sort of keeping it all nicely in balance. So fruits and vegetables, berries specifically, and greens, they're fantastic. They're the most antioxidant-rich foods. And also things that can increase oxidative stress in our lives, well, anything that you think of as unhealthy, really. So sitting too much, sleeping too little, not getting enough exercise, eating junk food, eating animal products, refined flour, refined sugar. These are all kinds of foods that increase oxidative stress. And if we look at it in terms of our blood vessels, they're pretty amazing. You've got this endothelial lining of the blood vessel. And this lining does an incredible job because it produces something called nitric oxide. And nitric oxide is fantastic because it's one of those substances that dramatically reduces oxidative stress. It donates the electrons, and it basically is a powerful vasodilator, so it helps your blood vessels to stay lovely and supple, and therefore reduces your risk of high blood pressure, which then reduces your risk of heart disease long term. Nitric oxide also has an interesting role in terms of insulin. Because this talk is about heart disease and diabetes, I thought I'd let you guys know that nitric oxide also makes insulin much, much more effective at grabbing the glucose from the bloodstream and putting it into the cell. So you can see the direct impact here that nitric oxide has on both heart disease and on diabetes, which actually might go some way to explain why some studies show that if you use mouthwash, you're actually more likely to get diabetes. Why is that? Why would that be? Well, if you're stripping your mouth of beneficial microbes that help in the process of digesting those fruits and vegetables containing the antioxidants, then you produce less nitric oxide, which means that you're at higher risk of diabetes. So it all kind of begins to link in together when you understand some of the underlying mechanisms involved. So, in summary, oxidative stress is not a good thing in excess, and you can neutralize it through healthy lifestyle patterns and eating antioxidants. What's the second thing that links both of these diseases? Well, remember I mentioned about hormones. And hormones have to be in the right balance in order to create health and longevity. So the first hormone I'm talking about is insulin. Obviously, we know of insulin as being the sugar transporting hormone. And it's actually the great transporter hormone because it transports fatty acids, it transports proteins, it transports everything. So it's really important. Without insulin, we die. And that's why type 1 diabetics have to inject it, because it's so important. But if our levels of insulin are too high, it also causes a problem. Insulin resistance, where lots of insulin is built up in the bloodstream, leads to oxidative stress. And it leads to increased risk of chronic diseases, especially heart disease and type 2 diabetes and cancer. So we have to have insulin in just the right amounts. Next thing is IGF-1, another hormone involved between heart disease and cancer and also diabetes. You have to have the right amount. Some people don't produce any IGF-1, and it's a hormone that's used to help us to use growth hormone effectively. So there's a small group of people in Ecuador, the Lerón population. They can't make IGF-1 at all. So what do they have in common? Well, they're all incredibly short because they've never been able to produce any of this hormone at all. But what really fascinates me about these people is that they tend to smoke, they might drink heavily, they might eat a lot of junk food, but they have a much, much lower incidence of heart disease and of diabetes and actually of cancer too. So there's something about having an excess of IGF-1 that contributes towards these diseases. And when we eat animal products, we make much more IGF-1 than when we don't. And also when we drink dairy, we get ready-made IGF-1 to drink as well. Cortisol. Have you all heard of cortisol? Yes. Most of you have heard of cortisol. So that's the stress hormone, one of the stress hormones. And we need the right amount of cortisol to live. We need it to help us get up in the morning. But if we have too much of it, it leaves us in a chronic state of inflammation, oxidative stress, increased risk of heart disease and diabetes. So if we want to minimize our risk of these things, then trying to engage more of our parasympathetic nervous system in whatever suits you is really a good idea. So meditation, reading a good book, even simple breathing exercises to try and stop the sympathetic nervous system from overriding you and increasing your risk of chronic diseases like heart disease and diabetes. Lastly, I'm going to talk about the satiety hormones, the hormones that keep us full. They are strongly linked to risk of heart disease and diabetes because when you eat a lot of food, then you tend to gain more weight, so you want to have the right amount of fullness hormones. And there was a recent study in Nutrients Journal where they found that plant-based diets actually produce the most satiety hormones, so the most hormones that keep us full. And they looked at all different kinds of diet patterns and discovered that it was actually most prominent in a plant-based diet. And that kind of makes sense when you look at this slide, because you can see that for the same amount of calories, your stomach gets a lot more full when you're eating fruits and vegetables compared to when you're eating very oily or very rich or animal product-laden meal. So that's one simple mechanism. And I'll come on to another one in a minute, because the third connection between heart disease and diabetes is the gut microbiome and also the gut lining. Now, you've probably all heard of gut health being a big thing these days, and it is really huge because so much of our health is tied up in gut health. So why do you think gut health has got a direct impact on heart disease? Does anybody know? Raise your hand if you've heard of any links between heart disease and gut health. Just a couple, not many, the doctors. So what's fantastic about having a good microbiome? When you eat fiber-rich foods, it doesn't just fill up your stomach like I showed you on the previous slide. It produces fantastic substrates called short-chain fatty acids. And these are fuel for your beneficial microbes. They need them to survive. And what do they do for us? Well, they regulate our hormones, they produce serotonin, feel-good hormones. But crucially, these short-chain fatty acids actually draw out unwanted cholesterol from our bloodstream. They also draw out unwanted or recycled hormones. So they draw them out and then we poo them out. So eating more fiber has a direct impact on our risk of heart disease. If we eat more fiber-rich foods, fruits, vegetables, whole grains, beans, lentils, chickpeas, we directly reduce the cholesterol levels in our bloodstream, which reduces our risk of heart disease. And what else around the gut microbe populations affects our risk of heart disease? Well, saturated fats can damage the tight junctions of our gut, which means that some of the bacteria inside our gut wall, the bacterial cell walls can get outside of the gut into the bloodstream. And these are called lipopolysaccharides, or LPS. And these are actually quite toxic, and they cause oxidative stress and inflammation. So there's two ways in which having a more plant-based diet is beneficial towards reducing your risk of heart disease. And what about diabetes risk? Well, these short-chain fatty acids are fantastic because they also provide a lovely mucin lining to the gut wall, which means that the next time you eat a high sugar load meal, it's actually absorbed much more slowly, which you can imagine would reduce your risk of diabetes over time. So you can immediately begin to see now where the links exist between heart disease and diabetes. There's one link that I wanted to share with you all, and that's the link with the toxin TMAO, trimethylamine oxide. This is a relatively new finding, and we're only beginning to really understand the implications of it, but it was stumbled upon by a cardiologist called Dr. Stanley Hazen, and he found this thing called TMAO, and he realized that it was actually strongly associated with increased risk of heart disease, increased risk of kidney disease, and increased risk of worsening of heart failure. So they figured out that this was something quite harmful, but they couldn't quite figure out why it was happening because it seemed to be present in a lot of foods, especially in fish, but actually quite a lot of foods contain it. But crucially, it's what our gut microbes do with it that counts. So when you're eating a diet that's rich in meat and eggs and cheese, the gut microbes that you have living in your gut are quite different from the ones when you're having a fully plant-based diet. And it's those microbes that you have to use to digest those foods that cause you to make something called TMA, which goes to the liver, gets oxidized, and produces TMAO, which then causes these toxic effects. So if you remove these foods from your diet, you're effectively removing the risk that you're going to react to this toxin. And they proved this was true by feeding a vegan a steak and noticing that they didn't have any TMAO at all. So again, the science is very young. And I think I know Stanley Hazen's clinic in Cleveland, they're trying to actually make a drug that will reduce the effects of TMAO so that people can still eat their bacon and eggs. I don't know. I think it might be best to avoid the bacon and eggs personally, but that's just me. So I hope you've begun to understand how these diseases are so intimately linked. And now I just want to talk to you a little bit more about humans, what actually happens in real life, in real people, and how we can begin to reverse heart disease. Some of you may be familiar with the Lifestyle Heart Trial. It was done nearly 30 years ago now, and the researchers wanted to figure out if somebody already had really bad heart disease, they'd already had a heart attack, what could they do to reduce their risk of another one? Was there anything that could be done, or was it just inevitable or fate? So they split the groups into two. They had a group of people who were given the normal advice of their cardiologist. They were told to eat well, moderately exercise, and see how they go. And the other group, they had a specific intervention where they told them to eat a low-fat vegetarian diet. They had to walk for half an hour a day, and they had a stress management class once a week. And they wanted to see the difference between the two groups. What they noticed was quite remarkable. In the intervention group, there was a dramatic reduction in the coronary artery narrowing. So they wanted an objective measure, basically, to see, were these people's heart disease really going away, or were they just feeling a bit better? Was it all psychological? So they decided to look at angiogram images of people's heart vessels to see what was going on. And what they found was that there was an 82% stenosis regression. That means that in the intervention group, 82% of all of the vessels that had thickening were beginning to disappear, and comparing that to the control group where there was no such difference. Then they wanted to look at them again a year later to see what was going on, to see if they'd had any differences or improvements. And the control group, the ones that didn't have the intervention, they were doing okay mostly. They'd reduced their cholesterol by about 5%. They reduced their LDL by about 3%. Unfortunately, they gained about 3 pounds in weight on average. But the intervention group, they did remarkably, as you can see from this slide, 24% cholesterol reduction, 37% LDL reduction, which is the small, dense lipids that are actually slightly more of a risk in terms of heart disease, and about 1.5 stone on average in weight loss. So big, big differences. Now, another study was done by the wonderful Dr. Colwell Esselstyn. He wanted to see if heart disease could be reversed through diet alone. Because he wanted to try and find out, was it just the fact that they were walking a bit more, or was it just the stress reduction? But so what he did was he got the most ill people he could find on the cardiology ward, and 22 of them to start with. And they'd all had loads of cardiac events between them. I think 49 cardiac events between these 22 people. They were basically on death's door. You couldn't get more ill than these people. And he introduced a whole food plant-based nutrition approach with minimizing the oils as well. And his results were truly outstanding. What he managed to achieve was that in these patients with severe heart disease, none of them became unwell in the time that he was with them. There was an 86% adherence rate, which means that most of them stuck with it, even though it was very different from what they were used to eating. Probably because they felt better, right? I mean, if your angina goes away, you're going to want to keep doing what you're doing. And you looked at their coronary arteries, and you can see a dramatic difference in the narrowing of those arteries. And you can see that in the next slide. Just to show you, on the left, red is good. It shows that the arteries are being perfused, and black is bad. And you can see there's a big difference between before and after angiogram images here on the right. You've got a lovely... oh, maybe I should use my pointer. But you can see that, can't you? You've got a lovely full coronary artery there on the right. Oh, how does that work?
Red.
Oh, the red one. There we go. So look at that. It's beautiful. Lovely full coronary artery there. Very stenosed and narrowed, not much blood going there. This is one of the people that were in his trial. Very dramatic results. So he decided to make it even bigger. He got nearly 200 people involved this time, and the results were just as good, if not better. 89% of people stuck with the diet for years afterwards. These are people, remember, who had, all these events, angina all the time, couldn't move, new lease of life. So of those 198, 89% stuck with it, which is a huge number. What happened to the ones that didn't stick with it? Well, of the ones that didn't stick with it, 62% had cardiac events. 62%. The ones that stuck with the diet, it was a 0.6% recurrence rate. So basically, if you stick with a whole food plant-based diet pattern, you're 100 times less likely to suffer from a heart attack or a stroke afterwards, which I thought was truly outstanding. So just one more with regard to heart disease, which just kind of really solidifies the information for you guys. It's the Mount Abu Heart Trial. It was done in 2011, and it was similar to the Lifestyle Heart Trial because they were having people do more of a plant-based diet, but they also did a little bit of yoga, which was another way of managing stress as well, and it was also a way of introducing exercise for the patients. And again, they had some fantastic results. There was a 91% trend towards regression of the artery stenosis in those that stuck with the diet, which means that those that had the diet and the exercise plan did much better than those that didn't. Their coronary lesions almost disappeared. So it really is a win for plant-based nutrition. And if you might want to keep that in mind, if you know of anybody who has heart disease, tell them to give it a try. They've got nothing to lose and just everything to gain. So now now that we've talked about what they have in common, I've shown you some very specific examples of studies that show us that this really works in humans. I want to briefly talk about diabetes, what it is, and again, how we try to fix diabetes as best we can. So type 1 diabetes. Type 1 diabetes, as I alluded to earlier, is a disorder where you can't make any insulin. And there are genetic factors, but there are also autoimmune factors. So most of the people with a genetic tendency to type 1 diabetes don't get type 1 diabetes. Only 10% of them do, in fact. There has to be an environmental trigger of some sort. And that might be some sort of environmental toxin, a virus exposure. We don't always know how it happens or why. But there are a few studies I've read that link early exposure to cow's milk protein to the development of type 1 diabetes. What happens is, if you are prone to creating autoimmune response, you may also be prone to creating a response against the foreign protein from milk, the beta-casein protein. And if you do, then it makes sense that you would also be more likely to create a response against your own pancreatic beta cells. Why? Because they look very, very similar. It's called molecular mimicry. So that's one of the ways in which people may be more susceptible to type 1 diabetes. So what about type 2 diabetes? Well, it's a disorder of genetics, yes, but also it's heavily a lifestyle-related disorder. So you have to be genetically susceptible, but it also, you have to have the kind of lifestyle which would predispose you to it. And people always say, oh, it's the carbs, you just cut the carbs, then you get rid of diabetes. Well, it's not that simple. I wish it were. But actually, what tends to happen when you cut the carbs, it doesn't necessarily affect your obesity rate, nor does it affect your risk of diabetes necessarily. This graph shows USDA data, and you can see that when people were starting to cut the carbs, the obesity rate didn't really go down. So there's lots of other factors involved. Sugary drink consumption, increase in animal products, increase in junk food in general, increase in calories in general. But then the question remains, what is the actual cause of diabetes type 2? And the underlying cause, in actual fact, you might be surprised to know, is mostly saturated fat. Why? Why would I say that? Because sources of saturated fat do something quite strange to insulin receptors. They don't like it very much. They clog up. And this happens not only with junk food, as you might expect, but it also happens with certain types of vegetable oils, and it happens with animal products. Any source of saturated fat will do this. And I want to just show you a little image to help you understand this process. So if you imagine you've got all these little red glucose molecules in the bloodstream, and they need to get inside the cell to give it some energy. And our bodies love using glucose for energy. It's the brain's primary fuel source, and you need it for muscles and ability to move and exercise. So the glucose needs insulin to allow it into the cell. It can't get into the cell without insulin. It needs that invitation. Once the insulin is bound to the insulin receptor with the glucose, then the glucose can go into the cell where it's needed for energy. If something goes wrong with that process, then the sugar gets stuck in the bloodstream. It can't get into the cell. And in this picture, you can see these gold insulin receptors. Can you see that they're just all clogged up and they won't accept the insulin anymore? And when the insulin can't get onto its receptor, then the glucose stays in the bloodstream, and so does the insulin. And then what have you got? You've got high blood sugars, you've got high blood insulin. Your body's thinking, crikey, I've got to do something to get rid of this, all this excess sugar. So it produces yet more insulin. The pancreas gets more and more and more. But it doesn't matter how many new keys you make. If the lock is jammed, then the glucose isn't going anywhere, and it stays in the bloodstream. That is the process of insulin resistance. And that is why having a whole food plant-based diet is able to reverse that process. Because once you take the saturated fat out completely, you have a massive increase in insulin sensitivity. The glucose gets from the bloodstream into the cell far more quickly, and you can actually use it for what it was there for. It's not the only way that saturated fat has an impact on our risk of diabetes. When we increase in weight generally, those fat cells, they get really full, and they start to spill out into the bloodstream. And then when you've got high fatty acid levels in the bloodstream, that's another driver of increased risk of type 2 diabetes and insulin resistance. It also damages our mitochondria. These are the little batteries inside our cells that keep us going. And when you've got mitochondrial damage, that's another reason why you're more likely to get diabetes. And one other thing, when you put saturated fats in a Petri dish with your pancreatic beta cells, can you guess what might happen? Can anybody guess? They don't like it. The pancreatic beta cells start to die. They start to die off. And this happens with palmitate, which is a saturated fat. When you put oleate, which is an unsaturated fat from things like seeds and nuts, in the Petri dish with the pancreatic beta cells, nothing happens, they don't die off. So that's yet another mechanism. So now you understand why it happens, and we also kind of understand a little bit more about what to do about it. I am going to talk to you about a few of the studies that have been done in humans that show us that whole food plant-based diet works very well, not only at reducing insulin resistance and increasing insulin sensitivity, but also keeping people slimmer for longer. Now, we've got the Broad study that was done in New Zealand. This was done by GPs, and they were able to get some overweight people and people with diabetes, and over the course of a year, they allowed them a whole food plant-based diet, and they said there was no calorie counting, there was no caloric restriction whatsoever. They didn't have to really think too much about what they were eating. They could eat as much as they needed to feel full, but it had to be more whole food plant-based. So incredibly, they got some fantastic results. People's blood sugars came down, they were able to reverse their diabetes, they were able to lose weight, and the same thing with the Adventist health studies. These are studies looking at people over a long period of time, and they're able to show that the more plant-based your diet is, the less likely you are to even get type 2 diabetes in the first place. Dr. Bernard has done loads of fantastic research over the Physicians Committee, again showing again and again that whole food plant-based nutrition is really good for diabetes control. If you want more details on these studies, please feel free to contact me on Instagram, or you can email me through Plant-Based Health Professionals, because I haven't got much more time today to go into those specific studies, but there are so many of them, and I'm more than happy to email you all of the references for that. What I really want to get onto now, because we're running short on time, is how you can introduce this into your own lives, because I want to make it easy for you. And the first thing is to really understand, dial down on what you can expect to achieve. If you have heart disease, what can you expect to achieve with a whole food plant-based approach? Well, hopefully, I've demonstrated that it's possible to reduce your blood pressure. You might have reduced need for medications, and you'll be able to reverse some of the plaques in your coronary arteries, reduce your angina pain, have a longer and healthier life, and also just enjoy your love life again. Because many people suffer from erectile dysfunction when they've got heart disease. If you think about it, the penile arteries are much smaller than the coronary arteries. So chances are your love life will have gone down the pan long before your first angina attack. What about type 2 diabetes and type 1 diabetes? Well, the results can be very dramatic. Again, I don't want to speak for everyone. I'm just talking from my own experience and also from a lot of the things I've read and studied. Type 1 diabetics, crucially, can expect a normal life expectancy. This is huge. Type 1 diabetics have a normal life expectancy potentially. Also, they have the opportunity to potentially reduce their insulin needs by up to 2/3. They can reduce their risk of heart disease, as we've discussed, and also reduce their cancer risk. Type 2 diabetics, I've seen them be able to reduce their medications by about half within the first week. That is how dramatically your insulin sensitivity can shoot up. It's quite amazing. After about 6 months, if you stick with the diet, then often there's a much less need for medication, and some people have been able to come off all their medications completely. You get a much more stable weight for a long period of time. You can improve your erections. You can hopefully prevent blindness. I've had some patients that have actually noticed that their eyesight got a lot better once they went onto whole food plant-based nutrition. And crucially, a normal lifespan. Not just normal, but healthy too. So you're functional and you can just enjoy your life. So how do we do it? Let's keep it simple. What do? In the words of Michael Pollan, we eat food, real food, not too much of it, and mostly plants. And this is a beautiful pyramid. There's another lovely plate that you can look at from the Canadian Food Guidelines, but this just gives you a nice look at what you want to have in your diet. Loads of fruits and vegetables, having whole grains, lentils, beans, chickpeas, nuts and seeds. Yeah, do take a picture if you want to, just to give you a visual aid. I can see a few of you taking a picture of that one. It's a lovely picture, it's quite beautiful. I also want to tell you, seeing as many of you may already be plant-based, And I don't want to give a lecture here because I also have enjoyed these foods and still do to a certain extent, but these lovely foods are not going to reduce your risk of heart disease or diabetes or cancer for that matter. So just think really carefully about the sometimes foods that you eat and aim to make them far less of a part of your lifestyle and make the whole foods and plant foods from the ground much more a part of your lifestyle. Because we know that processed foods really do increase risk of heart disease and diabetes and cancer. So people may ask you, if you're going to be advising your friends or family about this, well, where do you get your protein from? And I think you may all have had that question. If you want to take a screenshot of this picture, then it might help you answer that question, because all protein comes from plants. You don't have to worry about having the right source of protein in the right amount. As long as you're having a varied, whole food plant-based diet, you'll get all the protein that you could possibly need and more. In fact, many of us are in protein excess. It's really a fiber deficiency that we live in these days. The second question people will often ask you is, what about my calcium? Where am I going to get calcium from? Again, if you get asked, you can show them this picture and help to explain to them that calcium is in abundance in natural plant foods, and it's actually more bioavailable when you get it from green leafy vegetables compared to when you get it from cow's milk. So as long as you have an abundance of fruits, vegetables, whole grains, beans, lentils and chickpeas, herbs and spices, oats, all those kinds of foods, you're going to get plenty of calcium. You're going to get plenty of protein. This is an average kind of weekly shop for my family. It's just a picture I took once to give people an idea of what we actually eat, because many people get confused. They think, oh, what do I buy? And it's not perfect, I suppose, but it just gives you an idea of what a family of four might buy from the supermarket and what they might enjoy making. And if you want to get another quick aid memoir, it's the G-Bombs from Dr. Joel Fuhrman. Joel Fuhrman is an American physician, and he coined the phrase nutritarian diet, which basically means getting the maximum nutrients for the minimum calories. And he likes people to remember to eat their G-Bombs every day. G-Bombs. Greens, beans, onions, mushrooms, berries and seeds, the G-Bombs. So if you can remember those every day, you're going to do a great job at reducing your risk of heart disease, diabetes, and other chronic diseases. And look at these really inspirational meal ideas. So these are mostly my pictures, and they give you an idea of what you might want to eat for breakfast. So you could have a really healthy porridge or oatmeal bowl with your nuts and your seeds and your berries. You could try a plant-based smoothie. Aim, if you're diabetic, to minimize the fruits in there, please. It has to be more vegetable-based, really. And you've got your wholemeal bread. You've got all of the other fruits and vegetables. And also granola. Just be careful with the granola that you're getting one that's not too sugary. You can make it yourself at home, or you can get a low-sugar version. Oh, yeah. I thought I might share this really simple pancake recipe. All you basically need to do is add oats, nut milk of any choice, banana, baking powder, bit of cinnamon, mix them all together in a blender, pop them in a frying pan. There you've got some really delicious, healthy pancakes. So that's a lovely treat breakfast idea for you guys. Lunch. Lunch can be so simple. Basically aiming to have perhaps a salad with an oil-free dressing and loads of different ingredients. That's a really easy one. But you'd be surprised when you think about it how easy it is to make some simple swaps. And that's what I want to just encourage you to do today, simple swaps. So it's not too hard, it's actually really easy. I, for example, used to love having a chicken curry. Now I enjoy a vegetable curry or a tofu curry or a chickpea curry instead. If you're a fan of spaghetti bolognese, why not try a lentil bolognese? If you like chili con carne, you could try a 3-bean chili with a potato. If you like your roast dinners, then that's a picture of one of the nut roasts I made there on the right-hand side. Snacks are not too difficult either once you get your head around it. Basically, fruit, I think, actually is the best snack because it comes ready packaged by nature, and you can just eat it and it's done. Eating out is sometimes much more of a challenge. It's getting easier and easier these days to eat out, having a whole food plant-based diet. And these restaurant chains all have vegan menus, but you might want to say, if you're trying to reverse a disease, like heart disease or like diabetes, you might want to let them know, actually, I've got an oil allergy. I can't have oils in my food. And they may take that more seriously. Not that I'm advocating dishonesty, but I think it's important for them to understand that, you know, if you're trying to reverse a disease, it's very serious, and you want to make sure that you're eating something that is going to be healthful and not contributing to a worsening of it. These are pictures of some of the meals I've had out and about, which have been delicious and fully plant-based. Just for complete optimization, this is my opinion, I think that it's quite nice to have a B12 supplement, a vitamin D supplement, and an EPA-DHA supplement. And if people say to you, well, a plant-based diet can't be perfect because of all these supplements you're taking, I would argue actually a lot of these supplements are just as necessary, if not more so, for certain meat eaters. For example, B12. B12 comes from microbes in the soil, and so that's where the animals get them from if they're eating a natural diet. But most animals are factory farmed these days, so they have to get B12 from supplements in their feed. So I'm simply suggesting that you cut out the middleman and reduce your risk of disease as well. I particularly like the Boost B12 spray. That's just my preference. You don't have to use that. You can use any B12 supplement you wish. The reason I like it is because it's fully bioavailable in the methyl form and it absorbs through your tongue. And my kids love the taste of it, so that just makes it a little bit easier. Vitamin D is important for all of us. We don't get enough sunlight exposure in the UK, especially in the winter months. So this is suitable for everyone, a vitamin D supplement. And EPA-DHA, this is from an algae oil supplement. And the reason I recommend this is because many of us enjoy seeds, like flax seeds and hemp seeds and chia seeds and walnuts. But if we don't enjoy these foods or we don't always remember to eat them, it's quite nice to have a ready-made supplement. And algae oil is a ready-made EPA-DHA form omega-3 fatty acid. It comes directly from the ocean. In fact, it's where the fish get it from. If you ever wonder why fish are so full of omega-3s, it's because they're gulping on algae all day in the ocean. So this is just a way, again, of cutting out the middleman and getting it direct from its natural source. In terms of resources, I'd like to point you towards one of my favorite cookbooks. I don't get any paid endorsement from Ella, but I do like her books. I think she's great. She's got some really good whole food plant-based options, which are very low oil and also good for people with things like celiac disease. The How Not to Die cookbook is another classic. I would strongly recommend it, especially if you're going to be trying to reverse a disease. It's a really good book for that. And if you've got someone who's a bit of a man's man and they don't think they want to buy a Deliciously Ella book, then you can direct them towards the Thug Kitchen book. Okay, so what about the heart disease and diabetes topics that we discussed today? I really strongly recommend this book by Dr. Colwell Esselstyn, Prevent and Reverse Heart Disease. I think it's absolutely fantastic. Dr. Joel Kahn has some really good books out too. He's a cardiologist in the US, and this is his book, The Whole Heart Solution. If you're reversing diabetes, I would strongly recommend one of these two books for you to buy. Dr. Bernard's Program for Reversing Diabetes or The End of Diabetes by Dr. Joel Fuhrman. If you want some extra specific help, if you prefer online help, I would also recommend the Mastering Diabetes program. It is a brilliant online program. It's run by two men who both have type 1 diabetes, and they can guide you through a step-by-step mentoring program where you can reverse your diabetes through whole food plant-based nutrition. So I would thoroughly recommend that as well. Lastly, education is only one piece of the puzzle. Many of us make food choices unconsciously. We eat what we're used to eating. We eat what we grew up eating. We eat what our parents ate. We eat what the people around us eat. We barely even think about it most of the time. So it's not just about education, it's about finding a motivation to change. What do you think will drive you towards your healthier self? Have you got something that you're particularly looking forward to? Have you got a purpose in life that you want to fulfill through good nutrition, through feeling good, through changing your habits? Really think about that and try and think about that for your loved ones as well, because education is, as I say, a very small piece of that puzzle. So finding the simple swaps, making it easy, and really finding your why is the next step to making those changes. So, as I said before, I'm available on Instagram at Plant Power Doctor, on Facebook at Dr. Gemma Newman, and you can contact me through Plant-Based Health Professionals. And the last thing I want to say is thank you very much indeed.